Hi, I'm Chris Rourke, and for my community nurse presentation I chose St. Vincent's Mobile Health Outreach Ministry Program. The Health Outreach Ministry Program started in 1991 and it successfully promotes prevention through health screenings and education of the community. It brings fully staffed doctors' offices on wheels to areas of the community where these services are needed the most, and it also provides treatment to Jacksonville and its surrounding areas. Some of the roles of the nurses with the ministry are to provide free blood pressure checks, cholesterol checks, and glucose screenings, provide flu shots along with other immunizations, help treat chronic illnesses like asthma, hypertension, and diabetes, treat common ailments like respiratory infections and other nutritional problems, treat hearing, vision, and dental issues, and also to educate the population on some of the previously mentioned issues. We need to help patients understand what's going to help keep their blood pressure at a normal level, help to reduce their glucose and what foods to eat and to stay away from, things that are going to help reduce asthma flare-ups, especially educate on medications that we provide for those ailments such as respiratory infections and other common diseases that they might come across or infections. Some of the teaching and learning strategies that we have to use are a wide variety, actually, because we go to different parts of the community, such as the rural area. The ministry serves people who work in the agricultural fields of Putnam and St. Johns counties, including migrant workers and their children. We go into the urban community, and the ministry reaches out to the working poor, the homeless, and their families in the urban neighborhoods of Duval, Clay, and Nassau counties. And then we also have to work with pediatric population, where the ministry provides children and teens with access to medical care by going to 23 middle and high schools throughout Duval County. Some of the education and licensure that you're going to need to be a nurse with this ministry is your basic associate's and bachelor's degrees. That's required with any nursing degree. You want to have an active registered nurse license, which is issued by the state and in good standing. They want to have a minimum of 2 years nursing experience, and you also want to have your BLS, your basic life support. And if you have your ACLS, your advanced cardiac life support, or your ACLS, your pediatric advanced cardiac life support, that's going to be a bonus as well. Some of the other professions or disciplines that you work with, the mobile unit is staffed with doctors and nurses who work directly with the patients and providing their care, but also when needed, staff can communicate with any of the specialty departments located at St. Vincent's main campuses. So you're never out there alone if you need to get in touch with a cardiologist, a pulmonologist, a radiologist, pharmacist. You always have that ability to communicate with any of their other disciplines. Some of the skills that you're going to need, your usual, be able to assess your patients. You want to be able to do simple things such as vital signs. You want to have really good communication skills. You're working with a wide demographic there of patients. You want to have good general knowledge. As I said, you're working with pediatric, geriatric, psychological, and just your general population. You want to have good collaboration skills. You need to be able to work. You're in a tight space with that doctor. You want to be able to work well with him. You want to be able to work well with the doctors that you may need to communicate back at your main campuses. You want to have a good foundation of your nursing skills and knowledge. Just because you're working with that wide age group. You also want to be a good educator. These people do not get the opportunity to see a doctor very often. That's why this ministry goes out into the areas to provide that care, because we know these people do not get to see doctors that often. So you really want to drive home the importance of what you're teaching them, and they may not otherwise get that information. So you really want to be a good educator. Some interesting and unique things with this ministry is that it's the only mobile provider of free, acute, and preventative medical care in Northeast Florida. That's huge to these people. Some cannot afford it, other than the fact that they live out in the middle of nowhere, possibly. Some just can't afford to go to a doctor, so this is huge for them. The satisfaction that you get from this job is very unique. Most of us get satisfaction just from nursing alone, but these providers are going out to the community to people that can't afford and can't get this service at any other time, and you're there to provide that to them, and knowing that you're giving these patients something they otherwise won't get, and that really gives you a good satisfaction. And then St. Vincent's also, this program relies on donors and for those people that do donate money, that's what is allowing St. Vincent's to continue to deliver these critically important health services to the families in our area. So thank you to them. By the numbers here, we got a slide from June 2014 to June 2015. They've seen more than 17,000 free adult and pediatric services that they were able to provide. 2,700 were managed through the rural outreach ministry, and then 3,000 were managed through the urban outreach ministry. And when 10,000 were pediatric, through the pediatric ministry, and that included 3,200 physicals and 662 immunizations, and then more than 2,800 nutritional and dietary services. So they're reaching a lot of people with this ministry. Here's the reference that was all located from jackshealth.com. All the information's on there about the ministry. And thank you for your time.